Okay. Could you please state your name?
Dr. Lori Ann Scott
Excellent. Where do you practice?
in Lancaster, Ohio, founder of the Women's Comprehensive Health Center,
Excellent. How long have you been practicing medicine?
16 years.
Could you please state your name for us?
Sure. Dr. Michael Karam.
Where do you practice?
I practice in Cincinnati, Ohio.
How long have you been practicing medicine?
Going on 30 years.
Okay, my name is Dr. Christopher Olson. I live in the western suburbs of Chicago. Still in private practice with Edward Hospital, and I live in Naperville, which is about 30 miles west of the city of Chicago.
Could you please state your name?
Yeah, Marshall Scott Bovelski.
The practice in the facility or hospital that you
Right. So I work at Dedicated to Women, which is a group of 7 docs and 7 midwives, and we are in Dover, Delaware.
How long have you been practicing medicine?
I've been out of residency for about 10 years.
I started doing endometrial ablations back when we were using the YAG laser, so that was probably in the neighborhood of 20 years ago. And then I've continued doing ablations in my practice and have used and utilized the different technologies as it's evolved and technology has changes.
Well, I started them as a resident, so I've been out 10 years, so 12, 14 years.
The balloon came out in the late 90s, so 20 years. It wasn't out in my training or my residency, so it had to be learned after out in private practice. And then just gradually followed the improvements in the technology along the way. Dabbled in HTA, but didn't like it very much. That was more popular on the coasts, and then logically went to the best one on the planet, which is Minerva.
I've been performing endometrial ablations since 2003. Well, first and foremost, I've yet to have a failure. Now, not to say that I won't in the future, but that's pretty substantial evidence about the high efficacy of Minerva. Majority of my patients are amenorrheic, so of course they're incredibly happy. And I always give them the statistic, though, that by 6 months post-ablation, there's a 70% chance of amenorrhea. And that if the patient is still having some cycles, which are usually dramatically improved, so in of that in themselves, they are very happy with that, but that there's still a great chance they won't have cycles at all by 6 months.
The amount of bleeding, whether it's amenorrhea or just lessening the cycles, seems like it's better. It definitely has shown less post-op pain when they go home, especially after in-office procedures. They don't seem to need to use any narcotic medications for the first 24 to 48 hours, which sometimes with the NovaSure they did.
Competitive models are 30 to 40%, and certainly Minerva boasts double that, 60 to 65%. And certainly that will cut down on a lot of hysterectomy, because there are patients who just don't ever want a period again, but they don't want the time commitment involved in a hysterectomy, or they're nervous about surgery or whatever.
So the benefits of using Minerva is that it's very simple to use, very few steps. The generator itself is very simple for the staff to use. The device is very easy to set the uterine length, and the device is easy to insert into the uterus. And because the device is mobile and flexible, it makes it easy to accommodate uteri that are anteverted or retroverted.
So one of the things that I like about the Minerva is it's very simple in terms of staff usage. So you're always getting people and they're like, well, I haven't done this before, I don't know what to do. And you say, well, you hit the green button. You know, from a physician standpoint, it's very easy to walk somebody through it.
I think the graphics are phenomenally simple and fun to use, from the big red buttons to big green slides. It just you can tell the Apple influence there, but that makes it much easier. The other thing I didn't mention as far as safety goes is there's no data to enter into the controller. So you can't screw that up. You have to be able to subtract, and that's sometimes challenging, but if you can subtract 8 minus 3 and get the length, then you're usually there. But that's certainly very, very nice. And I think swapping out the containers is fairly straightforward for new gases. Well, I think there's a lot of advantages to the device. One, the size of the device. Two, the fact that it's covered with a silicone balloon, making it more lubricious, which is now my favorite word, to allow it to slide into the uterine cavity much more easily. We typically would have to over-dilate the cervix for the use of the competitive device, NovaSure, and then you're running the hassle of now trying to close the cervix over the device that you've already dilated to put it in. So that certainly made it a lot more awkward in that sense. So the device seats into the, it doesn't seat, the device is placed in the uterine cavity much more easily, and then there's just not a lot of consternation trying to pass your uterine integrity test. So the balloon inflates, you immediately get the feedback knowing that you have the integrity test is going to pass. Whereas on the other devices, you have to listen to a beep and wonder how long that beep is going to continue because you're not sure whether you have the seal or not. So the size of the device, the fact that the array is covered with a balloon, the fact that you have a cervical sealing balloon, the fact that it's the screen is cartoon-like makes it easier even for a gynecologist to figure out, and you can't overthink it or try to outsmart the device. You're going to sit there for 120 seconds, and that's an eternity for some gynecologists, but you know you're done at that point, and you may or may not have treated the entire cycle. I think that's really smart for not to let the physician hear the impedance tones so that they hurt themselves.
I like the idea of the occluding the cervix, because that's always an issue with anything that we do, especially when you were doing hydrothermal ablations, because the water would come out and you'd burn the vagina, which is horrible. And then if you can't get a seal, the device will not fire. So I've had issues in the past where you're putting tenaculum on to try to squeeze the cervix to get your better seal. I like this where you get the seal and then on the actual machine it tells you whether your seal is correct.
Liked the fact that the same engineers and designers that designed and engineered and launched NovaSure are the same engineers and designers that designed this product. And I think when I heard that they actually came back to surgeons and asked them, what kind of issues have you had? What would you like changed? Then they modified that and they came up with this system. I really liked the fact that that happened. I also like the fact that they addressed a lot of the issues that we had with the NovaSure, which is the one that I was using most frequently. The design of the device, the cervical balloon, the fact that you don't have to deploy it in the cavity, you just open it up and it's done. No maneuvers to seed the device, and also the fact that it had 3 types of ablation all in one, and the fact that it only uses 40 watts. To me, that was very important, especially in the office setting, because the higher the wattage, obviously the more discomfort that patients are going to have.
I highly recommend Minerva to my colleagues. Minerva has been perfected, and Minerva is wonderful because of the overall success rate. It has the best success rate on the market, and it has the best amenorrhea rate on the market. And so I think it's important for physicians to be using the latest, most successful technology.
So what I try to explain to people about all of the ablation devices have gotten really good. So it's almost like gas mileage in cars. So over the past 15 years, everybody's gas mileage has gone up. You're now at 25 miles per gallon. Now you're at 35 miles per gallon. So 35 is pretty good. But if you could get the same car at 55 miles per gallon, why wouldn't you?
And there are some significant changes in the results and outcomes maybe you want to look at. So maybe it's not the device or the generator, but it's the outcomes and the results that people are getting with Minerva. And then I think it's a matter of just having them, you know, at least try it. I mean, you don't know anything until you try it, and then you see how your patients respond. And usually my experience has been, if the product is good, it speaks for itself. And you don't have to push it on somebody. They're going to use it, and they're going to see the benefits in a fairly short period of time.
It's a no-brainer. I really don't care which device you like. This uses all three of the different major technologies to heat. In fact, it uses them all together. So whichever one you believe is somehow viscerally better, this device has the answer. Whether it's balloon, whether it's desiccation or convection heat like an HTA model, or whether it's just your RF array, whatever you believe is the best technology, it has those, so that's easier. Plus it's smaller and easier to place and safer, which is huge for OBGYN, which is becoming a fairly large part-time specialty. And it needs to be safe and easy.